neurodevelopmental disorders. You have autism spectrum. So there's normally some deficits in social communication, some restricted and repetitive behaviors, and the symptoms are present in early developmental period. That's pretty much early onset, like in childhood is where you're normally seeing these symptoms take place. Same thing with ADHD. Normally the symptoms are prior to the age 12. You have the inattentiveness or hyperactivity, two different types, the ADHD. ADD was the inattentive type, and normally the ADHD is the hyperactivity, but they're just lumped together as ADHD. Remember with ADHD, guys, you have to have it in 2 or more settings. So the individual can't present somewhere at home and then present somewhere at school, and we define them as having ADHD. It has to be the same symptoms that were showing up in 2 different settings. So school and home, home and church, they're presenting a certain way. That is how you're able to give them that diagnosis. So again, say for instance, you're like, all right, I got autism and I got ADHD. I'm not 100% sure. That's when you're gonna roll out here to your bootcamp tab, go to trainings and recordings, click again on the DSM dashboard, got it up there twice, and then you would clearly go down to the bottom and you see bipolar. For those of you that don't know how to use it, I just want to show you really quickly. If you go down to the bottom, that is how it's going to change the different symptoms. The different diagnoses that you're working with. So right now we're talking about neurodevelopment. We're going to go here and click on that, and then you can get more details about ADHD and some of the medications, some of the treatments, and some of the symptoms. And you can just study this part or cut and paste, make your own note cards or do whatever. Obviously, we have programs that have this a little bit more embedded in it, but for those that are in boot camp, make sure you use all the resources and everything you got, and this would be a good example of that. I see a few people up here in there now. So this is what you'll do to get more details about it. It's just kind of a DSM condensed really quickly. All right, so that is what you can use to supplement, because I know some people are going to say they struggle with mental health diagnoses and they need more support. I'm going to get you with the heavy hitting ones that are more likely to be on the exam than others. So we got the schizophrenia spectrum. Pretty much this is it, the rule of thumb. If someone's presenting, so look at this as all the same diagnosis. Look at brief psychotic, schizophreniform, schizophrenia is the same symptom. They have hallucinations, delusion, disorganized speech, often all are the same across the board. The difference between these diagnoses is the duration. If someone says, hey, this person has been having hallucinations, all the, inappropriate behaviors, word salad, they're not congruent, their speech and thought, all of that kind of stuff. They're giving you some things to let you know this person is definitely in a psychotic state and dealing with some psychosis, and the time frame is going to tell you all the difference. If they say, oh, they've been having this for the last 2 to 3 weeks, we know it's brief. And they say this has been going on for the last 2 months, we know it's schizophreniform. Anything 6 months is over, we're looking at schizophrenia and schizoaffective. I don't have schizoaffective on this slide, but that is what you're looking at. Someone can't have symptoms for 3 weeks and be like, oh my God, they're schizophrenic. We have to hit that 6-month time frame of consistency with these symptoms. All right, moving on to mood disorders. Comparing them all. You got bipolar 1, bipolar 2. I even have a little tag at the top. Bipolar 1 and 2, the way I memorize it or teach my supervisees is bipolar 1 has 1 more symptom than bipolar 2. 1 more symptom. That 1 symptom is what? Can someone tell me the big difference between bipolar 1 and bipolar 2?
Mania.
Absolutely. If a person has had a manic episode, they will not be defined as having bipolar 2. They will always be in that bipolar 1 category. So you must understand and remember, if someone has had a manic episode, a point in time in their life and have been diagnosed with bipolar, they have bipolar 1. The difference is the time frame. So hypomania, because someone might, be having euphoric symptoms. I've had someone ask me this. Their sense of euphoria, they automatically thought it was bipolar 1. It's the time frame that they're feeling on top of the world. If they've been feeling on top of the world for about 4 days or so, but they can come down on their own, then that's bipolar 2. But if they feel like they're on top of the world, they haven't been sleeping, they opening up businesses, they out there, having sex with everybody and anything and spending money left and right and stuff, that's a little bit more severe. And normally manic episodes last for at least 7 days. So normally the only way to address someone dealing with a manic episode is to have them hospitalized, because that's a severe impairment. So whenever you hear hospitalization in bipolar, you're normally leaning towards bipolar 1. All right, depressive spectrum. You have the major depressive disorder. That is pretty much someone having significant distress of impairment. Not seeing the mania and the hypomanic there, but for at least 2 weeks, this person is just having severe depressed symptoms. So that means the person is isolating. They're losing weight. They have a losing interest in doing the things they once liked. All those type of things are the symptoms that we're looking at. Persistent depressive disorder, what changes the game? How do you know someone has persistent depressive versus the major depressive?
Years, longer period of time.
Absolutely, that time frame, that is the big piece. So pretty much persistent depressive disorder, a way to think about it is Eeyore from Winnie the Pooh. He's always the same, just sad, just low grade depression. That is just the way to look at it, consistently down and all the time. It's pretty much just their personality at this point. That is persistent depressive disorder. 2 years or more in adults. How long in children? Don't have it on the slide, but how long in children, guys?
1 year.
Absolutely, absolutely. I hear you guys loud and clear. Absolutely, 1 year. Hey, this is for my private practice owners. If you're scheduling, charting, chasing payments in 5 different places, this is for you. I run a busy practice and systems are non-negotiable. The platform that keeps everything together for me is Jane. Clients book themselves, my schedule stays clean, charting happens inside the same system, so no late night paperwork. Whew. And payments handled right inside of Jane. Telehealth, client portal, documentation, all in one place. Clinicians don't burn out from clients. We burn out from chaos. Jane helps me run my practice like a CEO and stay grounded as a clinician. If you're ready to simplify, use my Jane Ambassador link below in the bio, and I'm telling you, Jane app is a game changer. It is going to definitely help take your practice to the next level. Anxiety disorders, generalized anxiety, panic disorder, specific phobia. The main thing here, look at the duration. 6 months or more for generalized anxiety. Panic disorder is about a month, and specific phobia is 6 months. So when you're looking at this, the key difference for this is generalized anxiety, the way that I think of it, they just worried about everything. It's the person is worried about their job, their school, their health, their relationship. Every time you turn around, they just worry about all of it. That is a generalized anxiety disorder. It's not a specific thing that they're worried about. So if you go to specific phobia, this person has a specific fear of one thing. Specifically, they fear spiders or mice or blood or flying or going out in public. Going out in public, what is that phobia called?
Agoraphobia.
Agoraphobia, absolutely. So this is important to understand these phobias, and that's a very specific one when someone is dealing with these symptoms. So that's the difference. Panic disorder, this is recurrent, unexpected panic attacks. Because people have panic attacks all the time. That does not mean they have a panic disorder. So make sure you understand the differences between those. And normally with someone with a panic disorder, they have persistent worry about having another panic attack. That is the difference. And they normally have maladaptive behavior because they're doing everything in their power to avoid having another panic attack. So that is panic disorder. So be mindful of that, have an understanding of these three. You're likely to see it possibly in some type of vignette or some type of question. All right, any questions so far?
I have a question. In regard to the panic disorder and the panic attacks. So a person who is experiencing a panic attack, they would not have considered a panic disorder?
No, panic disorder, you have to, anytime you have a disorder, it has to be a significant impairment to your everyday functioning and living. It has to be something that's ongoing. People have panic, somebody might have had a panic attack before boot camp today, just nervous and having anxiety, heart popping, populations going high, like all this type of stuff, and they're just really nervous, and they can pinpoint it. It's because I'm getting ready to do something different, or I'm worried about the exam, and it's something very specific. When someone has a panic disorder, this is ongoing. It happens all the time. It's unexpected, persistent worry. They worry about future ones. This is a disorder. So that's the difference between someone having an attack here and there versus someone having a disorder. Disorders are obviously something a little bit more significant, and they have a little bit more criteria that you have to meet in order to define it as someone having that.
So a panic attack is infrequent. Is that what you're saying?
It can be, yeah. Some people have a panic attack here and there, but if to define somebody as a panic disorder, they have to meet full criteria. So the best thing to do is for you guys
I missed that, though, interference.
The best thing to do, guys, when you're looking at, let's see, I don't know if I have panic disorders on here. The best thing to do for any of these diagnoses when you're not sure, I always say pull up your DSM, because we can deep dive and go into these, but pulling up your DSM is going to give you the most comprehensive idea of what these are. This panic disorder, I can't even, it's under anxiety disorder. Yep. Panic disorder is certain, here has the same thing that I have on the slide, but when you go into your DSM, if you're really confused on what's the difference, it's going to tell you specifically the whole criteria. That's the difference in the DSM. It's criteria that you have to meet. You have to meet criteria A, B, C, D, and E in order to be defined as having a panic disorder. So that is the importance of knowing any of these stuff. You have to have a certain criteria. I'm just hitting you with the main facts. But to truly diagnose someone with something, you have to meet a lot of different criteria to do that. All right, so the same thing with trauma and stress disorders, adjustment disorder, acute stress, and PTSD. If you pull up the symptoms for PTSD, it's huge. It's like, oh my God, it's probably like a page or two in the DSM of all this criteria that the person has to meet. So it's really important to understand before you just say, oh, this person has PTSD because they're having flashbacks, or the person is hypervigilant. It's more to it than that. So this, again, those are small things that can lead us to making a quick decision. But as a mental health professional, when you're assessing people, the best tool to have is your DSM, and then go through all the criteria to make sure you're not misdiagnosing someone. Adjustment, acute, and PTSD. The two here that are similar are acute stress and PTSD. The difference is the time frame. Acute stress is 3 days to 1 month. PTSD is a month or more, but they are pretty much the same criteria for the diagnosis. Adjustment disorder, that is something different. That is more of the symptoms can start anytime within 3 months, but it's normally someone that's experienced a divorce, job loss, death, something that's happened, that's the stressor, and as a result, it's been a life change that this person is trying to adjust to. So adjustment disorder is a very common diagnosis, but it's not something that's long-term. Normally after 6 months, that's it. The person, if they still have the symptoms, you're leading them towards having something more significant, like anxiety disorder, depression, PTSD, something along those lines. Hey y'all, your girl decided to do something a little different. Yes, you see me all up on the screen showing you these gold hoops, and boom, the gold ring. It goes perfectly with my simple style. You see, I got a nice little gold wedding band. Been wearing the same wedding band for 23 years. Yes. So you know I like something that lasts, something that's good quality. So I paired up with this company called Ana Luisa, and I'm like, you know what? I do test prep, but I got a lot of women on this channel, and they be live. I be seeing y'all on the little Zoom calls. So I decided, you know what? Why not partner with them? Get y'all an easy 25% off of all their stuff. I did the research. People are wearing this stuff up to 8 years. Yes, same exact rings, same exact jewelry. And you guys know I love me a good hoop. So if I can rock it with a nice t-shirt, you know, look at my Miss LCSW vibes t-shirt. You see that? You see that? If I can wear the nice little hoop with it and throw on the rings and throw them dreads to the side, honey, yes, I'm really quick in record mode. I got you. And of course, because I'm not going to do this video if they're not going to look out for my people, they're giving you guys 25% off. Click the link in the bio. And I also recommend you go to YouTube and check out some other videos because their product is amazing and very affordable. Lock in. All right, so here we have a 35-year-old client that comes to therapy reporting severe anxiety, flashbacks, and nightmares following a car accident that happened 3 weeks ago. The client states she's unable to drive and feels on edge constantly. What are we going with, guys? PTSD, acute stress, adjustment disorder with anxiety, or generalized anxiety disorder. All right, we got a lot of, I've seen every letter of the alphabet so far. A lot of A's and B's, and a lot of people picking D's. A lot of A's and B's. A lot of people saying PTSD. A lot of people are saying acute stress. So for those that are saying A, PTSD, can somebody unmute and tell me why did you go with A?
I went with, oh no, I didn't go with A. I went with
A month. That has to be over a month.
No, can someone tell me that picked A? Can they tell me why they chose A? Now they're not going to say it because someone shared the answer of why it might be another one. But a lot of you were picking A. So just keep in mind, I see people saying they can see now why. But just keep in mind, the scenario gave some really good details on which way to go. And the key was the timeline. The incident happened 3 weeks ago.
They were initially saying because of the flashbacks.
Yes, but I had shared early on in the presentation. Someone repeat what I shared?
And I shared.
When I shared the difference,
go ahead. Include the flashback, but if it has to be in a earlier time, more length of time with PTSD as opposed to acute stress.
Yep. So basically, I said that acute stress and PTSD are what?
Are similar in that they may show some of the same symptoms, but the time frame is the factor.
Absolutely. And what is the time frame?
If it's I believe you said it was if it's less than
3 days if it's
I don't remember.
3 days if it's acute.
Hold on. That's not, hold on, let her finish because that's, go ahead. What were you saying? I can't see the screen of who was talking at first. Was it you, Jack? Who was talking? Was it you, Jackie? I don't know. I was trying to recognize the voice. The person that was explaining, and I said, what's the difference between those two? Can you share why the difference between acute stress and PTSD? I'm sorry.
Well, you said acute stress disorder.
No, somebody was sharing. You had cut them off, but they were sharing. They were giving me the information. I just wanted them to go back and finish that sentence. They were on the right track. I just wanted them to finish. They said the heck with that. They was like, look, they done cut me off. I ain't saying nothing. But you were on whoever was talking you were on the right track. Basically with acute stress, it's a month or less. So basically this scenario said 3 weeks. So that kind of gave the answer. So that's for those that were trying to figure out the difference between A and B. That was the major difference. If it was PTSD requires symptoms to be present for at least 1 month or more. So that's the key difference between those two. Hopefully that makes sense.